Welcome to the Health on Track podcast. Let's talk well-being.
Welcome to the Health on Track podcast, your bi-weekly shot of wellness. I'm Hayley, your host, and I'm delighted to be here today with the remarkable Dr. Bello, a breast surgeon at King's College Hospital with a career of over 35 years in both the UK and the UAE. Dr. Bello's dedication to the cause and fundraising efforts for breast cancer support, raising a staggering £1.2 million. That is incredible. Her passion for making a difference led to the establishment of a prestigious breast unit in the Isle of Man, which earned her a recognition in the Queen's Birthday Honours List. Dr. Bello, we are so grateful to have you here today to share your insights and to talk about such an important topic. As October rolls in, the world is filled with pink ribbons signifying Breast Cancer Awareness Month. It's time for us to delve into the vital topic of breast cancer and unravel its complexities. Dr. Bello is here to share her extensive knowledge, her experience, shedding light on a disease that is one of the most common cancers worldwide and affects a significant number of people. According to the World Health Organization, breast cancer is the most frequently diagnosed cancer in women. So settle in and let me once again thank you, Dr. Bello, for joining us here today.
Thank you very much for having me here this morning. Yes. I couldn't miss the opportunity.
Oh, we are so excited to hear. I think the first question for breast cancer is what... We hear it all the time, breast cancer. We hear it. I think, I don't know the stats on this, maybe you do, how many people it affects in the world today. And I think we all know someone that's been affected by it, whether it's kind of family or whether it's a friend. Personally, I'm actually going through, one of my best friends has got breast cancer and she's going through her treatment right now. So how do we look out for the symptoms of breast cancer and what does that mean?
You've very rightly put it. It's one of those diseases that whether you like it or not, you will know somebody who have it. So the way I tend to make people realize how important it is, if you have 8 women in a room at any point in time, one of those 8 women will at some point have breast cancer. That's how common it is. Mm-hmm. However, let's not get too carried away that, oh wow, cancer is so common, breast cancer is so common. It's the only disease where we've made so much difference. All you need to do is go get checked, it gets picked up early, and you're good to go. So even though it's a very common disease, majority of women will survive breast cancer and carry on living a normal life.
Okay, that's really interesting. So in regards to symptoms, does it carry symptoms? Is it something that you just need to go to get checked regularly, or is there like red flags?
There are red flags, but what I tend to say is make your breast your best friend. So examine yourself once a month if you still have a period, a week after you've finished your period. That's the best time because the hormones are then kind of on the level where the breast is not symptomatic, meaning it's not painful, it's not lumpy. And what you're looking for is just get to know what your normal breast feels like. And it involves having a feel, lying down in bed, going into the showers, standing in front or sitting in front of a mirror. And what you're looking for is any changes at all. What I hate to do is rattle down a list of symptoms because you might miss things. So if, for instance, you have breast nipple discharge that is bloody or fluid, clear fluid that never was there without you exciting it, what we call spontaneous, get someone to check it out. If you find a lump in your breast, get someone to check it out. If you find a lump that is not even painful, get someone to check it out. If suddenly your breast size changes or you feel there's some changes in the way the skin of the breast looks, or you have a strange rash around your nipple, get somebody to check it out. You're not a doctor, so it's not your responsibility. That's what the doctors are there for. So get to know your breast, make your breast your best friend. And once you feel this breast feels abnormal, or it wasn't like this a month ago, or suddenly the size has increased, get someone to check it out. And breast cancer doesn't respect age. So young or old, get somebody to check it out. And I must put this plug in. Men can also have breast cancer. So it's not exclusive to women. So same thing, men should look out for lumps that were not there before or changes in that I've just described. And they should get somebody to check it out.
Yeah, that's a really important thing. Everyone always thinks it is just women that can develop breast cancer, but it is men also, so men should.
Yeah, men should. Definitely, men should.
Yeah.
The only thing is that for every 121 women who have had breast cancer, you will find a man who has breast cancer. So the incidence or the frequency is commoner in women because we have our beautiful hormone, estrogen.
The one that fluctuates all the time.
That gives us all the cancer and makes life so unbearable for us.
Yeah.
Yeah.
No, thank you for that. And I think that's a really good point you mentioned, because not all of us sit there and think, oh, I should naturally, we're so busy with our everyday lives and you forget to prioritize yourself, and you're trying to look after so many things. You're looking after your family, you're looking after your health, your wellness, but actually that is wellness as well. If that goes undetected, that's going to become a problem further down the line. So,
definitely, I couldn't agree with you more.
Yeah.
Because once it affects you, the dynamics in the family changes completely. And you don't want to put your families through that.
Yeah.
And if you pick it up early, things can be done and you can slot back to where you left and the family can carry on.
Yeah. So in terms of, I loved the fact you said make your breast your best friend, breast best friend. So in terms of, if I, for instance, myself, if I was to find an unusual lump or any of the symptoms you just mentioned, what's my first point of call? Because a lot of people were recluse and now, oh, it's nothing, until it's then something. What is my first point of call, and how can we let the listeners know out there that it's not scary? We just need to go to the doctor and make sure that what it is.
Thank you for that. Because what's scary is when you run away from the reality. It's like having a house that is burning and you keep piling rocks on it, hoping that, oh, the fire is going to go out. No, it's just going to burn. So please, when you find any of these symptoms that we mentioned already, go see your doctor. Go see a breast surgeon. Luckily, here in the UAE, it's very easy to go and see a doctor. It's not like in the Western world, for instance, in the UK, where you have to go and wait at your general practitioner for weeks. Please just make an appointment and see your breast surgeon, and you will be seen immediately.
Yeah. No, for sure. As you can probably hear from my accent, I am British, and I do know the struggles with that. And here, you can get an appointment the same day if you need to. It can take 10 minutes in and out. So there is really no excuse to go and do that. So it is any doctor that could see you, or it has to be a specialist?
Well, a specialist is always better. However, if you saw a family doctor who can screen you, that's fine. But with breasts, with the number of centers you have here in Dubai, you've got to be very careful. Pick who you go to see, because it's not uncommon that people kind of waste a lot of time because they just want you to keep paying. I'm sorry to say this on the air, but pick your doctors, go to the right places where you know that they have breast specialists so that they can assess you properly, rather than time wasting, going and doing all the tests and then coming back again and again and again. One, you've wasted money. Two, you've wasted time. So please choose your doctors carefully. I couldn't say that enough. So make sure you research who you're going to see. Go find a breast surgeon. There are quite a few breast surgeons in Dubai here. We work at King's College Hospital, where we have quite a few good breast doctors there.
Yeah. Amazing, thank you. And talking of screening, if I or anyone listening here doesn't have symptoms, but they're thinking, should I go and get checked? Should you go and get checked anyway, even without symptoms? And if so, how often?
Well, what screening is trying to find out a disease that has not presented itself. So the WHO has criteria for screening, and breast cancer ticks all the boxes. So it's a test that is easily accessible, a test that is not invasive, a test that can be reproduced, a test that can pick up the disease. So breast cancer ticks all these boxes. So for screening to be useful, you have to be at the right age. So here in the UAE, screening starts from the age of 40. And you go every year, you get a mammogram, what we call two views, where the mammogram is done in two different positions, and it gets read. And then, because most facility here, in order to kind of make the accuracy even better, we add an ultrasound scan of the breast to it. So it's a mammogram and an ultrasound. Examining your breast is not screening. Just going for an ultrasound scan is not screening. And if you have a symptom, it's different. Screening means picking up something that has not been found. So from the age of 40, that's when we recommend regular screening for the general population. However, there are ladies who are at higher risk. For instance, if you have the genetic type of breast cancer, where you have to present yourself a little bit earlier. So from the age of about 30 or so, you need to be going for screening, or if you've had exposure to things that will make you at a higher risk of breast cancer, like what we call mantle radiation for people who have had Hodgkin's lymphoma, or people who had other risk factor, like lumps were found in their breasts, which puts them at a higher risk. Such people we will screen a lot sooner, and we don't use a mammogram because they are young. So we do ultrasound and we do an MRI. Okay. So that's when MRI becomes a screening tool. But for the normal ladies who are normal, no history, no risk factor, mammogram from the age of 40.
40. That's really good to know, because I think it varies, doesn't it? And obviously, this will change depending on what region you're in Middle East.
Yeah.
So it's just best to check with the government regulations of what age that is.
Yeah.
Here, as you said, in the UAE, it's 40. But do you know what the age is in Qatar? Bahrain? Are you aware of those? Is it same as 40 or?
I don't think it's the same. As you all appreciate, the quality of healthcare in Dubai and Abu Dhabi and places like Sharjah definitely is different from the other Emirates. I couldn't tell you. I think it's majority of people would throw a mammogram and an ultrasound scan at you as soon as you walk through the door. I've had patients who are 20-something years old and they said, oh, I had a mammogram. Really? Why? So that's why it's so important that you kind of look at this, do a little bit of research, take ownership of your health and have a little read about where you're going to. So ideally, there's no point in throwing mammogram at young people because it's not sensitive. The breast is very dense. That's why we don't recommend it. And it's unnecessary radiation. Mammogram by itself does not cause breast cancer, but if you expose people unnecessarily, then you're putting them at some additional risk of contracting breast cancer, which they shouldn't.
Which is what they're trying to not.
Yes,
That's what
exactly.
Okay, that's really interesting because I wasn't aware of that. You would think in my eyes, going for a mammogram, it was not going to cause anything because obviously that's what you're trying to look for.
Yeah.
But now, obviously, understanding the radiation elements of it, it can cause.
Yeah.
And it's just better to wait until a certain...
Yeah.
Unless you have symptoms.
Exactly.
But saying that, there is ways in which you can screen without having to do a mammogram if anyone is concerned or would like to check with a doctor.
And I just plug in, I don't want people to have this erroneous belief that, oh, when I have a mammogram, I'm going to get breast cancer. The ratio of mammograms that will cause an ultrasound scan, you must have had well over 250,000 unnecessary mammograms. So for 250,000 women who have had mammogram year on year on year on year, you may pick up one lady who got breast cancer because of the radiation. The amount of radiation you get from a mammogram, it's nothing equivalent to the amount of radiation you get from a chest X-ray. So a chest X-ray that we all do for our national insurance, or here it's called the work card, the usual card that you get. That amount of radiation is actually more than what you get from a mammogram. And we all walk around in the sun here, we sunbathe, and the amount of radiation you get from the sun in 4 weeks, it's more than what you get from a mammogram. So please don't feel, oh no, I'm not going to go for a mammogram because I don't want to subject my breast to the risk of contracting breast cancer.
Or just in case.
Or just in case, exactly.
Better to get checked.
Yeah.
And so obviously it's a really sensitive subject, and it's one where people feel nervous to go. People will feel nervous to go in for a mammogram just in case, or what ifs. And obviously if you did find a lump, it's quite nervy to think, what's that gonna bring? Like what happens next if this is? And our minds are very good at kind of over-analysing, thinking about the worst case scenario. If something was found in a screening, what are the treatments available?
Well, if majority of people who come to the clinic with a lump, it's very important to reassure everyone. Maybe if I have 10 ladies come to me, of that 10, maybe just one person may have a lump that is dangerous. So majority of lumps are not breast cancer. Majority of thickening are not breast cancer. So once we find a lump or we find something in the breast that needs to be further tested, after the mammogram, we do an ultrasound and then we do a biopsy. When we say a biopsy, we're not going to start slashing you, cutting you open. People think, oh, wow, it's major. No, it's very non-invasive. We use a needle, they numb it with local anesthesia. It's like going to the dentist. And they numb the skin and they just make a little puncture big enough for the needle to go in and get sample. And once this sample is taken, then the pathologist, which means they look at it under the microscope to see whether the cells are abnormal. And again, there's this horrible myth that, oh, if they take test or if they do a needle test, they're going to spread the cancer or they're going to cause cancer. That's not true. What really spreads the cancer is ignorance of having a dangerous lump and not having it tested. So please, don't feel a needle test is dangerous, and honestly, it's not painful. It's numbed with local anesthesia. I'm actually more terrified of the dentist than having a biopsy.
Yeah, true. I think everyone is. No, that's really enlightening. I think someone who's never been through it, myself, when I hear people similar to one of my best friends who's going through it right now, she says a lot of things like biopsy. And I've heard the term. Do I know what it means exactly? No. So thank you for explaining exactly what that means and how important it is, but the procedure is minimal and non-invasive and doesn't hurt.
No, it doesn't. We give you plenty anesthesia.
Yeah.
And in my hospital at King's College, I've got this lovely set of ladies who would make you feel so special. And every woman who walks through the door is so special to us. And I hope that every other person does the same, because us women are special. And when you have a lump, you are at your vulnerable point, and it's very alarming for most patients. So please don't let that scare you. We train our staff to make sure they are empathic enough to understand your anxiety.
That's great that you guys do that, because obviously being experts and seeing it day in, day out, you've seen cases that are very severe and you've seen the cases that turn out to be just a lump of muscle tissue. But for the general public coming into the surgery, they're full of anxiety, they're full of stress, they're full of worry. They've already worked out a plan of what happens when I'm told I have breast cancer, because we see it so often, and it's something that we hear so often as well. So I think that's really nice and great that you guys, and I can tell from your energy, you will be like a very empathetic person. So thank you to you and your team for doing that.
Thank you.
So if the biopsy comes back that it is breast cancer, what happens then? If you can talk me through that?
Well, not the best news to give to a lady.
Yeah.
So routinely, whether it is cancerous or not cancerous, I have a policy that no biopsy will be posted in your apps to say to you, this is the result, and we never ever give results over the phone. You can imagine the shock, the anxiety that goes with it. So once somebody is told they have breast cancer, we do what we call counseling. I give you the result, I tell you what it is, and let it sink. I don't rush you. We take our time. It might be 2-3 visits before we get to that point of discussing the next step. So the next step is you need to know what else the cancer has. So there are so many features. You want to know the receptors, which is whether it's estrogen sensitive or progesterone sensitive, or whether it has the protein called HER2 receptors. You want to know how active it is. You want to know the size of the cancer. So we look at the mammogram, we look at the ultrasound scan again, and we do this as a team, not unilaterally. So we have what we call multidisciplinary team meeting, where we go through all these tests very carefully, so that no mistakes are made, and following that, a decision is then made. This lady needs surgery up front, or this lady needs something else doing first. And something else might be she needs an MRI because we want to check the other breast, or she needs, all patients with breast cancer, we stage, which means you want to know where else it could have traveled to. So you check the armpit with ultrasound scan, you do PET scan, sometimes you do CT scan, depending on where you're based, and we do blood tests, what we call tumor markers. So everything to give us as much information as to the history of the breast cancer. So it's like when a plane crashes, you get the black box. You want to know what happened. So for breast cancer, we kind of go to the wire to just make sure we have all the information. And once we've collated all the information, then we plan the treatment. If it is surgery, some ladies are able to get a lumpectomy, which is just taking a little bit of the breast tissue out. And for some ladies, that may not be the case. They may need to have the whole breast off. And sometimes we might offer them chemotherapy prior to the surgery, what we call neoadjuvant chemotherapy. That's just to reduce the stage of the cancer. So for instance, if the cancer is big and chunky, or it's already in the lymph node, you want to shrink it down a bit so that you minimize the extent of the surgery. So that's what we call downstaging. And when we've done that, you have to go through all the chemotherapy based on all the special character of the cancer. So it's not one size fits all. So I treat you as an individual. I actually call it the signature. Everybody's cancer has a signature. So it's not one treatment for everybody. So it's quite intense. It's intense for the surgeon. So you can imagine how intense it is for the patient. So it's a lot of visit and a lot of information. And we also have people who psychologically can support you. I train my nurses so that they can chat to you, and I bring you back so that we can just sit down over a cup of coffee to just talk about things. And then we supply you with so many literatures and refer you to suitable sites, not Google. Yeah. Dr. Google is dangerous. So please, ladies, don't visit Dr. Google when you have this kind of diagnosis. Let your doctors guide you, because Google, as good as it is, all the information there is for the general public. It's not specifically tuned to you. Breast cancer is a very individual disease. No two women have the same cancer.
Yeah. That's a lot of information, even for myself. It's so complex. Every case,
it is,
and especially for you, certainly. It must be so difficult to kind of, as you were saying, I didn't realize how you kind of go back to where did it start, how did it start, what's happening in the body for it to start, and where do we think it's going to get to? So what's the plan of action here? As I said, I have personally had a number of people in my family have breast cancer, and now one of my best friends, and just hearing the terms you said, CT scan, PET scan, all these terms, and for someone who hasn't been through it, it's really hard to understand all these terms.
It is.
And there's a lot, because as we said, it's complex. So you have to go through a number of different things. It's not just, what we'll do is we'll operate it and take it out.
No.
And I think I was naively, when I was younger, thinking, well, why don't they just take it out? Just remove it and then it's gone.
Yeah.
But yeah, like you said, there's a lot to it. And it's great to know that you actually can minimize it before the surgery happens, then it's less detrimental to the body and and the process of healing. Yeah. Is there anything that we can do to minimize breast cancer, or is it luck of the draw?
Well, before we go to that topic, and this initial treatment, you might need other things in addition. Okay. Some people may need chemotherapy. Some people may need tablets called endocrine blockage tablets. Some people may need radiotherapy, especially if they've had lumpectomy, which is just taking the lump out, because if you didn't do that, the cancer is going to come back. And some people may need additional treatment even a year down the line. So, yeah. And some people might need to stay on the hormone tablet for at least 10 years onwards from the initial treatment. So I'm mentioning this because those are some of the things that will stop the cancer from coming back. Okay. So if your additional treatment is not completely carried out, or if you default with taking your tablets, that puts you at an additional risk of the cancer coming back. So don't go lazy, don't worry about the side effects. Yes, they're annoying and they interfere, but there are things we can do. So to reduce the risk, those additional treatments is very important. And for those women who have already had breast cancer, lifestyle changes is very important. I couldn't say enough about that, because the lifestyle you lead is so important, especially after breast cancer. Fortunately, breast cancer is one of those areas that lifestyle has been researched enormously in. We know that if you pile on weight after breast cancer, the risk of it coming back is higher, because you're forming extra fat, so you have extra estrogen. If you eat fast food, obviously those things will contribute to you putting on weight. So it's important to look after what you eat. I'm not here preaching for anybody to go on organic or this. Eat normally, but eat healthily. Lots of carbs. People think, oh, no, I'm not going to eat carbs because the breast cancer cells are going to feed on the sugar. I'm going to eliminate sugar because, no, that's not true. Those are all myths. The important thing is healthy eating. Don't pile weight on and go and gym like crazy. Think about exercise like a tablet. Once you've had breast cancer, it's part of the additional things you need to do. It's recommended that you do about 150 minutes of exercise a week to try and kill that possibility of the cancer coming back. And for those women who haven't had breast cancer, what can you do to stop breast cancer? Well, love yourself. Make your breast your best friend so that you present early, and obviously healthy lifestyle. Those are the things you can do things about. Certain things you have no power about. Being a woman, or the fact that estrogen causes breast cancer, or if you have the genetic type of breast cancer, is out of your control. But lifestyle, you can do things about. So looking after yourself, eating healthily, exercising, and making sure that you don't pile on weight. And alcohol, it's a very big thing about breast cancer. Luckily, in this environment, alcohol is not an issue, but Dubai and some part of UAE, being such a cosmopolitan city, we've got expats from everywhere. So please, ladies, don't overindulge in alcohol. 1 unit of alcohol a week is plenty, but if you're in the habit of too much alcohol, we know that alcohol can increase the risk of breast cancer. I said can, I don't say it will, but it can increase the risk of breast cancer. And the other things we know is when people go through the menopause, because breast cancer is an aging disease, though we see it in young people, they might want to go on HRT. And HRT, which is hormone replacement therapy, has estrogen, and the pure estrogen ones are not so good. But if you take the combined one with lower estrogen with some progestin in it, those may be okay. But please, menopause doesn't last forever. So after 5 years, get off the tablet.
There was a lot there. And I think, I mean, firstly, I just want to say thank you so much for joining us. There was so much that I've learned, and I will be booking a session to come and see you just to kind of check how, after a baby, I've had a baby recently, so how my body's doing and how my breasts are as well. So thank you for sharing your feedback and your valuable knowledge that our listeners might not have had the opportunity to have. So you're based at King's College. You and your team seem like a lovely bunch. I really want to come and have coffee with you guys. And I think the thing that I've learned from here today, and I hope everyone else has, is trust the doctors. Don't trust Dr. Google, especially when it comes to such a sensitive topic such as breast cancer. Because like you said, not one size fits all. Every cancer is different.
Yeah. Choose your doctors too.
And choose your doctor wisely.
Yes.
Thank you so much. It's been a pleasure.
Thank you.
Thank you.
Thank you for having me. And I hope this has been useful. Let's not wait for October before we look after ourselves. Breast cancer can happen anytime, not just in the month of October.
Thank you.
Thank you.
Thank you so much. So we hope you enjoyed today's session. Our next episode will tackle another important aspect of cancer treatment, one that is not talked about enough. Cancer treatment and the mental health. We're available on YouTube, Spotify, and Apple Podcast. Until next time, stay well and keep thriving.